Understanding the genetic health risks of Australian Shepherds. Are Australian Shepherds prone to certain genetic disorders? The Australian Shepherd, also known as the Aussie, is a beautiful and intelligent breed that has gained popularity all over the world. Originating in the United States and not in Australia as its name suggests, Australian Shepherds have become beloved pets and working dogs due to their exceptional herding abilities, loyalty, and vibrant personalities. However, like any other dog breed, Australian Shepherds are not immune to genetic disorders. While they are generally healthy dogs, there are certain conditions that they may be prone to due to their genetic makeup. In this article, we will explore some of these genetic disorders and discuss ways to mitigate the risks associated with them. One considerable genetic disorder that Australian Shepherds may be prone to is hip dysplasia. Hip dysplasia is a condition that affects the ball and socket joint of the hip. It occurs when the hip joint does not develop properly, leading to a loose and unstable joint. This condition can cause pain, lameness, and arthritis. To reduce the risk of hip dysplasia, reputable breeders often perform hip evaluations on their breeding dogs and only mate those with healthy hips. Similarly, elbow dysplasia is another genetic disorder that Australian Shepherds may be prone to. Elbow dysplasia occurs when the bones that form the elbow joint do not fit together correctly. This can result in lameness, pain, and early-onset arthritis. Responsible breeders again take steps to reduce the risk of elbow dysplasia by screening their dogs and only breeding those with healthy elbow joints. Epilepsy is another genetic disorder that can affect Australian Shepherds. Epilepsy is a neurological disorder that causes recurring seizures. While the exact cause of epilepsy is still unknown, there is evidence to suggest that it can be inherited. Australian Shepherds with epilepsy may experience seizures of varying severity, ranging from mild seizures that cause momentary confusion to more severe seizures that require medical intervention. Veterinarians can help manage epilepsy in Australian Shepherds through medication and lifestyle adjustments. Collie eye anomaly, CEA, is another genetic disorder that may affect Australian Shepherds. CEA is an inherited eye disorder that can lead to a range of vision impairments, including partial or complete blindness. Responsible breeders often perform eye examinations on their dogs to identify any signs of CEA and avoid breeding affected individuals. Of course, these genetic disorders are not guaranteed to affect every Australian Shepherd. But it is essential for prospective owners to be aware of these potential health risks before bringing an Aussie home. If you are considering getting an Australian Shepherd, it is advisable to research and find a reputable breeder who conducts proper health screenings on their breeding dogs. It is worth noting that genetic disorders are not the only health concerns that Australian Shepherds may face. Like many other breeds, Aussies can also be prone to certain non-genetic conditions such as allergies, ear infections, and obesity. It is crucial for owners to provide proper healthcare, regular exercise, and a balanced diet to keep their Australian Shepherds healthy and happy. In conclusion, while Australian Shepherds are generally healthy dogs, they may be prone to certain genetic disorders due to their genetic makeup. Responsible breeding practices, such as health screenings and selecting appropriate mates, can help reduce the risk of these disorders. However, it is essential for potential owners to be aware of these potential health issues and take necessary precautions when selecting a breeder. With proper care and attention, Australian Shepherds can live long, fulfilling lives, bringing joy and companionship to their families.